Hello and welcome back to the Vertigo Doctor YouTube channel. My name is Dr. Madison Oak and I am a vestibular physical therapist here to help you with all things dizziness and vertigo. Neck pain and vertigo. Why does it matter? What is it? Why does it happen? And is it really from the vertigo? First of all, vertigo is a symptom and not a diagnosis. So if you are feeling the incorrect perception of moving, sliding, or spinning, that is by definition vertigo, but it is just a symptom. It's not a diagnosis. So if you've been diagnosed with vertigo, that is when you need to go find a new doctor to give you a real diagnosis and not just tell you your symptoms. You already know you have vertigo, right? That's just a symptom. It's not helpful information. So vertigo as a symptom oftentimes has to do with neck pain. So let's talk about my two hot topic reasons about why. Number one reason that people get neck pain from dizziness and vertigo is that they stop moving their neck. So when you get dizzy, and maybe this relates to you, I've seen this time and time again in my patients, but when you get dizzy, you all of a sudden go, okay, if I just don't move my neck and I'll just kind of move around like a robot a little bit. I'm serious. This happens all the time. This could be you, could not be you, but it could. I kind of like just have been guarding my neck and I move like a robot and I just don't move my neck ever again. I'll never get dizzy again. I already have neck pain from doing that for like 5 seconds. Okay. So if that is you, and if you are guarding your neck, you don't let your neck move, you don't turn and look at people like this, you don't look up, you don't look down, because that could make you dizzier, right? Which is completely understandable. If you held let's say you go like this with your bicep and you kind of flex, right? And if you hold your bicep in like that all the time, it's going to start to hurt too. It's going to start to cramp. You might get a Charlie horse. All that's good, not so good stuff, right? So the exact same thing can happen with your neck. So with your neck, what we want to do is try and relax our neck muscles and strengthen the really deep. Now, the deep, deep, deep internal neck muscles are called our deep cervical neck flexors. They're super teeny tiny and they do this amount of movement. Ready? Watch me close. See how small that is? I'm not moving these muscles. That's how small that movement is, but they are exceedingly important. What they do is they not only nod your head a teeny tiny bit, but they also stabilize your neck so that when you're up like this, you do this all the time to feel like your neck is stable, and they'll help you do lots of other cool stuff. So if you're a person who holds their neck like this to not be dizzy anymore, it can actually be causing a lot of that neck pain. And so having a physical therapist evaluate your neck and say, okay, this is weak, this is tight, this is strong, this is what we need to work on, whether it's upper back or in your chest or in your neck, all those things are going to help with your neck. We have a 6-week neck progression that I actually use with my patients. If your physical therapist is like, I'm not really sure what to do, you can always bring that to them as well. It is a feature in vestibular group fit. Another reason that you can get neck pain from dizziness and vertigo is vestibular migraine. Vestibular migraine is the most common cause of dizziness and vertigo in the central nervous system. So again, it's a migraine disorder. I have a whole 20-minute long video on vestibular migraine if you want to learn more, but it can cause neck pain. So again, neck pain is a feature of migraine in general, and vestibular migraine is not cut out of that. It is also a feature of vestibular migraine. What this means is if you have a migraine disorder, neck pain is a symptom of that. And it's not that there's anything wrong with your neck. Most of the time, you'll get all your imaging back, your x-rays, your MRIs, and they'll say, oh, you have a bulging disc or nothing's wrong at all or whatever. And you're like, okay, that has to be the problem. Then you go to PT for your bulging disc or you get it surgically repaired and you're like, but my neck still hurts. That's because it's coming from migraine, not because it's coming from your bulging disc. And that was probably actually an incidental finding. Not for everyone, but for a lot of people. An incidental finding means I have this pain in here and we go in and we find a bulging disc or that have disc degeneration or whatever. We start to blame the problem on that when in reality, it wasn't that at all. It was your migraine disorder. So if you have dizziness and vertigo, some other funky kind of migraine symptoms, so that's light and sound sensitivity, maybe a visual aura, maybe a motor aura, maybe another sensory aura, and you have other migraine symptoms, and you're also having this neck pain that comes more when you get dizzy. So you're like, I get this neck pain, and then I get kind of dizzy, and it's kind of intermittent. Now the dizziness is there, now the neck pain all the time. that could be an indication that there is vestibular migraine present that's causing the neck pain. So you have your trigeminal nerve, which is your nerve right here. There's three prongs in it, and it is a cranial nerve. There are 12 cranial nerves. Your trigeminal nerve is number 5, and your cranial nerve is in your face, and it innervates like all up in here, and it has a connection with your cervical spine. So trigeminal cervical nucleus, that connection. So when this starts to kind of flare up, it will also flare up your neck a little bit. For people with vestibular migraine, that will go from your cervical spine to your vestibular cervical vestibular combination, and that nucleus, I mean, we don't really know why vestibular migraine happens, but like that could have something to do with it as well. So that kind of triangulation, neck pain, dizziness, vestibular migraine. So that is something that's really good to know. I hope you enjoyed this video. Let me know any questions you have below for the 2 top reasons I see neck pain associated with dizziness and vertigo. Remember, vertigo is a symptom. It is not a diagnosis. Holding your head like this creates a lot of weak muscles here and not a lot of strength in those really deep muscles. We definitely need to do that and help relax our neck. I know it's hard, but it is possible. And then we also need to be evaluated for vestibular migraine if you have neck pain and dizziness and vertigo. Talk to you soon. See you back on the channel. Subscribe.